안녕하세요. 호주인맥의 알렉스입니다. 자, 오늘은 제가 몇 달 전에 찍은 영상 중에 방사선 관련 영상에 다니엘이라는 친구가 쏘아 올린 영상이 있었습니다. 이 친구가 유니 에세이라고 남호주대학의 방사선학과를 다녔고 저에게 방사선학과를 추천해줬던 친구인데요. 오늘은 현지인의 관점에서 한번 들어보도록 하겠습니다.
My name is Daniel Andriski. I'm a third year medical imaging student and I previously completed a degree in advanced health and medical science. So in medical imaging we use devices such as X-ray machines, CT machines, in order to capture images of the internal structures of the patient's tissues and bones in order to help treat them more effectively. So in first year, we mostly learn about the foundational aspects of what it is to be a radiographer. So there's a lot of anatomy, there's a lot of physiology and a lot of physics. But as the studies tend to go on, you do little bit less of that and you focus more on the actual job itself. So like preparing patients to be in the correct position, communicating well with them, a lot of ethics and privacy, and just a lot of aspects like that to prepare you for when you're working in the field. It gets more difficult in different ways. So in first and second year, there's a lot of memorization. So you're moving through body systems very fast. You might only spend a week on the immune system, a week on the digestive system, and that's very important, but it's not as crucial as positioning patients and working directly with them. So the start is very general, and as you move on, it becomes very specific into the actual job. Why did I choose this major? I really like working with patients. And I'm also very interested in technology and computers. So I thought radiography would be very well. It's a lot of patient interaction, a lot of interesting technology, and it's just something I found that would really be suited for my personal strengths and weaknesses. It's a very good question. So typically each semester you need to do 4 subjects which are about 10 hours worth of work each week. So that'll include your in-person time at the university as well as your self-time at home. So there's lectures, practicals and tutorials. So the lectures, that's just 1 to 2 hours a week of content from the professor. So they'll all be recorded and you can watch them as many times as you want. Then tutorials, that's more of a paper and pen bookwork. So that'll be solving some problems and overviewing the concepts that you learned in the lecture. And then there's practicals, and that's more hands-on activity. So that will be working more directly with the machines and working with patients and just things like that to get you more comfortable with the theory that you're learning. So every class is a little bit different. Some classes might have a quiz each week worth 2 to 5%, but other classes might just have 1 or 2 big tests a year. So you really want to allocate the time you spend studying to the weighting of the grade. So if it's worth a lot of percentage points of your overall grade, you want to spend more time doing that. So you're meant to spend 10 hours each week on each subject, but some weeks you'll have big assignments due and you'll spend a lot more time on that subject compared to the other subject. And as you go through university, you will learn more effectively how to allocate your time in order to get the highest grades. So every year it's a little bit different. Sometimes you go rural, like deep into Australia, the outback, the country towns, and that's where I went earlier this year. And there's different types of clinics that you would do radiography at. I did mine at a hospital, so there's a lot of different departments, a lot of nurses, a lot of other things you need to do. Then there's also private clinics, which is more checking up on people's ongoing conditions. Say for example a hip replacement, you would want to get photos of that every couple of months or so at a clinic, whereas a hospital is more trauma environments, more injuries you would expect to see there, and that can really affect how you approach your practice. So in trauma cases in hospitals, you want to be a bit more faster, a bit more agile, quite quick moving, whereas clinics it's a bit more slower paced, a bit more patient centered. You want to make sure they're more comfortable because it's not as an urgent decision. But throughout different placements, you'll learn different skills and different ways to approach different tasks, and it really makes you a well-rounded professional. I would even say that it's much more effective to learn on placement than the books, because the books they're great, the theory is great, tutorials, practicals, very helpful, but there's nothing replacing the actual real-world experience you would do in a placement setting. That's a good question as well. So I currently work in phase 1 pharmaceutical research. There's always a lot of hospitality and retail work to do, but what I would recommend for an international student is to try to get a job in the same field as the degree you're studying. So for example, if I wasn't working in phase 1 research, I might try to do disability support work or carer, because the skills I learned in that job will help me grow and develop my skills as a radiographer. But there's always plenty of jobs around. It's just trying to find a good job with, good. Right, so when I graduate as a radiographer, I'll only be qualified to perform X-rays on people. But that's a good first step, because after that you can do extra training to get certified in CT or MRI or ultrasound. They can usually take a few years to get those certifications, but while you're working in a practice, more than likely the place that's employing you will want you to be qualified to work in those imaging modalities. After I graduate this, I'll be qualified to work in X-ray, which is quite a good start. So being only X-ray certification gets you around about a median Australian wage, but when you specialize into other areas of medical imaging, your pay can quite substantially increase, especially if you get more than one. So if you get ultrasound, CT, MRI, you'll be quite on a very high salary. Yeah, so the English speaking skills, it's just important that you can communicate with your patients. The verbal language isn't as important, because in placement I sometimes have to perform X-rays on people that can't speak English, and that becomes, you work around those issues. You use more acting out motions, you talk with your hands more. Sometimes there's interpreters that can help you. It can be challenging if your skills in English aren't very good, but they can develop quite quickly as you progress throughout your degree. So I think if you're passionate about learning and you have a good work ethic, you'll do very well studying in Australia, and you'll more than likely move on to a good career path at the end of your degree. I want to see it at the end.
Alright, thank you so much.
That's alright.